and tabled legislation to begin steps towards a pharmacare program right across the country. It was a key commitment needed to keep the NDP's support of the Liberals. All of it still needs to be negotiated with provinces, and there are questions about whether it will really lead to universal coverage. I spoke to the Minister of Health, Mark Holland, on Friday. Minister Holland, thank you for making the time. I appreciate it.
Thank you, Rosemary.
I want to start with the two classes of drugs that will be covered. I think you said probably sometime early next year. How did you decide on those two classes? Why did you choose those?
Well, we're making really historic investments of $200 billion over the next 10 years in areas like primary care and workforce, and making sure folks can age with dignity, both at home and long-term care facilities. So really trying to help provinces, but we also really need to be downstream. We need to be investing in prevention and the things that stop people from getting sick. And so these are two areas where we think we can make a real difference. First, in diabetes. I think it's an indicator of a healthy society, how we're managing diabetes. And with contraception, making sure that women have access to the contraception they need means that they get to take control of their reproductive future over their bodies.
You said the two drugs are proof of concept to see how it works. What do you mean by that? Like you want to see what kind of uptake there is? You want to see if provinces buy in? What is the proof of concept to convince you that this kind of coverage is needed?
Well, we have two different models. So we have in Prince Edward Island, we have a model where the folks who don't have existing insurance, we're working on, trying to eliminate their copays, get those copays down, fill in the gaps for people who don't have coverage. So you could call that a fill in the gaps type model. It's less expensive, but there are some concerns that it is not as comprehensive. The other model is the one we're doing now with diabetes and contraceptives. It's across the country. This is going to make sure that people, regardless of their income, regardless of their age, can have access to diabetes medication. Also, we're working on devices so that folks can get access to pumps, monitors, syringes, test strips, and then also contraceptives. And so we want to evaluate in the real world, as opposed to something that's hypothetical. How do these two models perform? How do they affect health outcomes? What are the costs involved? So that's one of the reasons we're setting up this committee to look at these issues so they can inform the path forward on the basis of science and data.
That to me, though, sounds like a government that is not promising universal drug coverage going forward. That to me sounds like a government promise to see what works best.
No, I think both models are universal. Like, let's be clear about that. What's different is
but one is where people have it. One is people have insurance and can opt in or not, and the other is it doesn't matter. You get it no matter what. Is that not the fundamental difference?
No, so maybe I didn't do a good job explaining it. So in one model, what we have in kind of looking at in PEI is to basically, you have a provincial spend, you have insurance spend, and then you fill in the gap. So you're universal, everybody gets it. Another model, you displace insurance companies and it's only delivered by government. And so you have a single payer in a single administration. So it's all within an existing system. And, we could spend a lot of time talking about the debated merits and pitfalls of both systems. But what we're trying to get at is what's the most efficient, efficacious, and effective way to get everybody covered and to make sure that coverage gets the health outcomes we want. So what's great about this is we're going to be able to evaluate two different models in real time and see which one is the most efficacious, both in terms of health outcomes and financially to get to the health outcomes.
Is your partner in this, though, the NDP, are they as willing to consider the PEI model as the other model? Because it doesn't, I thought they only wanted the one idea that the federal government pay for everything.
You got it, Rosemary. Yeah, the NDP has been very clear. They want the single payer universal, totally paid for by government, total displacement of insurance companies. And my comment, and this was a point of very, a lot of difficulty in the negotiations with the NDP and with Don. I said, okay, well, let's take a look at the data. Let's actually see this in the real world. And let's also have the committee look at what are the actual costs involved in that system and how the heck we would pay for it. We want to do it in a way that is the most respectful of taxpayers. So how do we get to that? And I think we really need two real world models, because this debate has been too philosophical. It's been too academic, and we actually need real world models to see what the differences are when you have proof of concept actually existing in the world.
Okay, you've spoken to all your provincial counterparts. I know that you said that on Thursday, and you've spoken to Alberta's health minister, and they have already said we are not interested in opting in. Do you expect that that will change because they will see other provinces, sort of like what happened with healthcare, do it and they'll go ahead? Or what seems to be their reservation around this?
Well, I think, Rosemary, that's a great point to bring it to the analogy. We have the Working Together Agreement, which is on working with Alberta on primary care and working on workforce issues. We got that done. And you remember a lot of folks said that wasn't going to get done. That was a tough negotiation. But Adriana Lagrange is very reasonable. We're just about to get to the finish line on the Aging with Dignity Agreement in Alberta. That's huge news as well. I'll be back in Alberta to announce that. So I've had a really strong initial conversation about pharmacare, and I think we share a lot of the same objectives. And so I think we can work through this. It's going to take time to negotiate these with the provinces. So we have a couple of provinces who are super eager, want to be on the front lines, want to do this right away. And that at the same time allows, us to go and negotiate with the other provinces to get things rolling. So this is going to roll out piece by piece. But just to come back to the earlier point, I want to be clear. We want to see, for early provinces, folks getting their diabetes medicine covered and contraceptives. We want to see that, hopefully even by the end of this year, to see folks actually getting that, because we think it's critically important.
Let me ask you one quick question, if I can, about the Winnipeg Infectious Disease Lab, where the government finally released some documents to get a sense of what was going on there. Scientists who were fired, they've been cleared to work on top secret projects, and CSIS discovered that at least one of them had been sharing some of that information with China officials, is what we understand. Have there been changes to the vetting process at that lab? How worried should Canadians be that this could be happening on a regular basis, given that it happened once before?
Well, it's not. Absolutely not. And I think what was
so how do you know that, though? Have you made changes?
Yeah, that's what I'm getting to. Okay. I know I'm starting with a value statement. I just want people to know first, and now I've got to back that up with what has changed.
Go ahead.
So in 2019, in the field of infectious disease, there was really great cooperation happening globally. And leading up to that point was a very different environment. We would have never imagined that two Canadian citizens, two eminent scientists, would be lying to the Public Health Agency about the work that they were doing and the connections that they had. It really was shocking to see that two Canadian citizens would do that. And so, that really changed the threat analysis. And of course, as at that moment in time, China, we were starting to have friction, no question. Yes. But there wasn't the indication they were trying to infiltrate our science and infiltrate some of the other elements of our industry in the way that they clearly are. And so there's been a real ramping up of the protections and the screening. And unfortunately, really, even when somebody's an eminent scientist, even when they're a Canadian citizen, now we have to have very deep work being done constantly around their security clearance, using open source technology, having detailed interviews with all of their connections. That's the environment we live in, because we have hostile actors who are looking to infiltrate our science and use it perhaps for dangerous and malicious purposes. So we cannot allow that to happen. And regardless of somebody's citizenship, regardless of how well respected they are in the scientific community, we can take nothing for granted, and we don't.
Minister Holland, thank you. Thanks for your time. I appreciate it, sir.
Thank you, Rosemary. Much appreciated.
British Columbia became the first jurisdiction in Canada to offer free prescription contraceptives. Cost can be a barrier for many to access birth control. Shylo Peterson's a BC resident who uses the program herself, and I talked with her a little bit earlier. Shylo Peterson, thanks so much for joining us.
Thank you for having me.
So because you live in BC, you've already benefited, I guess, from birth control being covered by the province. Tell me how that changed things for you, what impact that had.
It allowed me to have the opportunity to pick birth control that was best for my needs rather than what I was able to afford. Ultimately, it eased my ability to be a lot more perceptive to what my actual needs were, rather than having to worry about the cost exactly. Yeah. Yes.
Okay, well, and now you'll stop me if I'm asking too personal questions, but tell me a little bit what you were trying to decide between. Were you like just using sort of regular birth control? Just tell me what your experience was.
Previous birth controls that I've been on, I found my body didn't react well to them, or
Sure.
the hormone throughout my body, it just didn't work for me personally.
Got it.
Or what my lifestyle was. And this gave me the opportunity to look into other forms of birth control without having to think about the cost. So I was able to find something that would work best for what my needs were and what my body was telling me, and what would be best for me moving forward being on birth control.
Was that an IUD? Can I ask?
Yes, I ended up going with an IUD.
And so what was the price difference there, and why was that a factor for you?
So for the hormonal IUD, which is what I went with, they can go upwards to $500, $550.
Totally.
So, which is a one-time cost. Whereas previous birth controls I was on would be like the pill, and that would be a monthly cost, usually around $20 to $30 per month. Okay. So a little bit more accessible in the short term, but in the long run, having the IUD makes a lot more sense for me. So I was in a position that I would have found a way to pay the larger cost up front, but only recently I've been in that position. So previously I wouldn't have been able to pay that upfront cost at all. And after doing some reading, after speaking to my GP, the IUD was the most logical choice for me. So it just made it a lot easier to make that choice without having to factor in how I was going to afford it, or how I was, choosing a more middle ground one that may not be what was best for my body.
What do you think it means, like, for you and friends or just women, about having access to contraception for free of their choosing, without having to think about what it costs? Like, what kind of difference do you think that makes for women?
I think it makes a huge difference for women, especially in our current economic state, to not have to factor in that to live the lifestyle that they want to live. And it makes it much easier for them to choose what's best for their body without having to submit their body to something that it may not work well with their body, because that is the most accessible option for them because of cost.
The idea that this might now be across the country, of course, provinces will have to opt in, and not everyone is necessarily on board, but the idea that this could be offered to women across the country, how important do you think that is?
I think it's incredibly important. Just the small period of time that BC has had it implemented, it's made a huge impact on people's perception of how they're able to live their lives, and not having to factor in accidentally starting a family that they didn't mean to, or, it just alleviates a lot of stress for people, I believe.
Yeah.
And having a nationwide option for it is really the best way to move forward as a country, in my personal opinion.
And what do you think, too, of the idea that, reproductive health for women, that is sort of that is one of the first priorities for this program? Because I'm not sure reproductive health is something that everyone's talking about all the time, frankly.
I find a lot of people are still really cautious in talking about it. And I find, especially when it comes to the program in BC, I find not a lot of people fully comprehend the benefits other than reproduction and reproductive health. They don't fully comprehend how this is actually beneficial on a larger scale rather than just on a personal scale.
Well, Shylo Peterson, thank you for talking about all that personal stuff with me. I think it makes a difference to put a person to the policy. So I appreciate you sharing your experience. Thank you.
Yeah, of course.